Hi, I'm Anton Enus, Ambassador for Bowel Cancer Australia, and I'm here with Professor Mark Molloy, the inaugural Lawrence Penn Chair for Research into Bowel Cancer. Mark, a great night, of course, for boosting funding into bowel cancer research. Tell us, first of all, why you think it's important to have this big focus on research.
Thanks, Anton, and thanks for your time tonight to come and talk with us about what we're doing in bowel cancer research. So I'm not sure if people are fully aware, but the problem is huge in Australia. So we have almost 17,000 people are likely to be diagnosed with bowel cancer this year. And so research really offers us a chance to change that, to make a difference. And so we want to do research into how can we better prevent this disease, how can we diagnose it earlier so that people can get the treatment they need earlier, and then for people that have bowel cancer, how can we better optimise treatments they receive so that their outcomes can be the best they possibly can.
So in setting up this chair in bowel cancer research, obviously Bowel Cancer Australia and all its supporters are putting their money where their mouth is.
Yes.
What kind of difference do you think it'll make?
Well, look, let's hope that it can make a difference in how we treat our patients in the clinic. That's what it has to do ultimately. So if we can apply the type of research strategies that I'm going to bring to this chair, such as the molecular analysis of tumours, applying genomic methods and protein analysis methods, and we take that back and apply it on a regular occasion by our clinical researchers on individual patients, we can get better outcomes for those individuals. Therefore, we can save lives and hopefully decrease the cost of care associated with bowel cancer research as well.
Now that sounds very technical, what you just said there. Could you give us a sense in terms that we can understand what it is that your work will do?
Yes, so I'll give you an example in two areas. So one problem we have is that polyps in the bowel, some of those can spread and become cancerous. So what we'd really like to do is to be able to know which ones of those polyps are likely to go out of their benign state and move into a tumour. If we can use analysis of those polyps and define a pattern or a signature associated with that particular polyp developing into a cancer, then that offers us a chance to intervene in a much more efficient way. A second example are very early bowel cancers. There's a challenge to know how's the best way to treat those. So should we do a radical surgery to remove that tumour, or can we escape with a much more benign approach to treatment? If we can use molecular analysis, looking at the genes and proteins in those tumours, that might then give us pathways for surgeons to take to choose the best pathway that will benefit the patient the greatest.
Well, certainly in my own experience, we had exactly that kind of decision to make. As do you go with radiation, do you go with chemo, do you go with surgery? They're all valid choices. How, in terms of what you're bringing to the table in your research, how will it change sort of day-to-day treatment options and diagnostic options?
So research it's a long field, if you like. We have to go through multiple phases. So there's a discovery phase, there's a validation phase, and then there's an implementation phase. So that whole process can take years depending on what we're trying to actually achieve. But that's what we'll do. We'll start at the beginning, we'll work towards implementing and validating this in the clinic, and once it's been done, validated in the clinic, then it can be applied in a much wider setting. It'll change practice guidelines. This is important for making a difference to people not only in cities like in Sydney and across the country in regional centres. When guidelines change, clinicians will follow that pattern of care.
We're certainly seeing a big boost in funding through this chair that's been announced as a cooperation between the University of Sydney, Bowel Cancer Australia and the Colling Institute.
Yes.
Is the kind of technology that you use in your work very expensive? Is it difficult to bring that kind of research to the table?
Yeah, so there's a couple of challenges. The cost of instrumentation is always a challenge to be met. So mass spectrometry is an example of the technique that I use. Those instruments range from $500,000 upwards, and so that's a lot of money that we need to find to take on these challenges. Secondly is making sure we have well-trained people highly experienced people that have done years of study to be able to operate these instruments and get the most value out of the analysis of those specimens when we put them through these high technology instruments.
How can people watching this that may have been diagnosed themselves through the cancer process, or their family and friends who want to support them, how can they help you?
Yeah, that's a great question. So I think one of the things the Lawrence Penn Chair does is it creates a bit of a head of steam, if you like. And so we need to use this opportunity to build a partnership with the community, with people that are recently diagnosed with bowel cancer, those at high risk with bowel cancer, those that are survivors, and those families that are affected by bowel cancer, to engage with them, to be part of research programs. You know, that's always a challenge, to make sure we have participants in our programs. For them to be out there raising awareness as well, talking about the type of research activities and why it's making a difference in their lives. If we can do that, I think we can elevate the potential of the funding that's being realised for the Lawrence Penn Chair.
So if there was somebody out there who's watching this saying, well, what kind of awareness raising could I do? What kind of information could I supply to you? How would they get that to you?
So I think we use Bowel Cancer Australia as the interface for doing that. So we'd really welcome the opportunity of people to go and explore in their networks, in their workplaces, how they might assist us with fundraising, and then providing that feedback to Bowel Cancer Australia. That money will go into research. That will allow us to hire PhD students, as an example. That will allow us to purchase instrumentation that we can use to analyse tumours. That will allow us to pay for the running of the laboratory, to go to scientific conferences and present our work at those meetings. Bring all that back and increase the efficiency of the type of research that we're doing.
And I certainly know from my experience, of course, I'm fairly new to the whole the cancer universe, as I call it. I'm learning new things about it all the time, and I certainly feel that I've been one of the fortunate ones in that I was diagnosed early, and that created treatment options that were not there before. But I always say to people now, my main message to them is talk about it. You know, make yourself aware, arm yourself with information, and know what your risk profile is. Be prepared to ask awkward questions next time you see your GP. And you're resisting that idea of the screening process or the colonoscopy. Just get over that and do it, because it could save your life. I mean, what's the message you would send to people?
Well, I mean, taking your example for the screening program, I mean, this is a program that's a national program. It's free. I mean, that's a rarity. It only occurs every 2 years. It's a 5-minute effort to take the test. We need to get more people doing that. It saves lives, as you've found out.
The screening program, as we know, it doesn't solve all the problems. It solves some of the problems and give us some information that will help us with the treatment and diagnosis of bowel cancer. In terms of the process that you're involved with, the kind of research you're doing, does the screening program, if more people were involved in the screening program, would that help your work?
I think getting more people involved in the screening program is a great thing for our community. We know it's not foolproof, the screening program, but it's the best that we have at the moment. So one of the avenues that I'll be undertaking in my research is to try and come up with secondary tests that perhaps are less invasive than the need to go to diagnostic colonoscopy in the first instance. If we can offer that as a secondary test to people to motivate them of the urgency of needing to go and have the colonoscopy to really diagnose whether they have a tumour or not, well, I think that's a huge advantage, and that's the type of research that I'm quite motivated to undertake.
It's of course a multi-skilled, multidisciplinary approach to fighting this disease, and I guess if we're ever going to find a cure, we have to put all resources in. I think it's worth noting that Bowel Cancer Australia is completely funded by community efforts, by supporters, by just ordinary people who are giving $1 here and there. So I think it's important, if people want to get involved, they want to be engaged in the process, whether you're a patient yourself or just a family or friends of people who are involved, if you've got a few spare dollars, that's one way of supporting the process. But also I think just being aware, just having a look at the website, just finding out what's available, it all helps, doesn't it?
It does. And the team at BCA, are professional people in the sense that go to their Twitter accounts, go to their Facebook feeds, look at their website. They're always putting new information on there to try and raise the public's awareness of this disease and promote approaches that people can take in changing their modifiable risks to try and decrease the likelihood that they'll encounter bowel cancer.
If you were to look forward in the next few years and to see where we're going with this initiative specifically, is it a game changer in your opinion? Are we going to see something completely different in, say, 5 years' time, the way we approach cancer?
I think in science we're a little more conservative. 5 years is really a short time frame in terms of research, but what we have to do is work towards that pathway. We need to be using the best technology with the best people to try and make these changes. If we can do that, well then we're well advanced in working towards new approaches, as I've said before, new approaches to prevention, new approaches to stopping the spread of cancer, new approaches to early diagnosis, and better approaches for treatment when people have the disease. They're what we need to focus on.
Mark, congratulations on your appointment to this very exciting new boost in funding for research into bowel cancer.
Thank you for your time, Anton.